My name's Alan Simpson. I'm a Professor of Collaborative Mental Health Nursing. I lead the Centre for Mental Health Research in the School of Health Sciences at City University of London. Yeah, so I suppose the findings come into three main findings. So first of all, people spoke very positively about their experiences of inpatient care, which is important. They said that they were treated with sensitivity, respectfully and with compassion. And that's really important because there's often a lot of negative publicity about psychiatric services, mental health services, and in particular hospital care, and a lot of stigma attached around mental health services. People said overwhelmingly their experiences were very positive. Secondly, people said that their hospital admission was an important part of their recovery. And so obviously people being admitted to a mental hospital are often particularly mentally distressed, particularly unwell, but they said that period of time of calm, of times of reflection and people sort of looking after them enabled them to take those first tentative steps on their recovery, and that was really important. So the hospital stay was important, and also for many of them receiving medications and the support of the staff and their peers. Thirdly was perhaps less positive. So people said they were very aware of being kept safe on the wards, which is really, really good. And they were aware of staff working hard to try and speak with them and care for them and so on. But they didn't feel actively involved in making choices, being given information and being directly involved in their care and decisions being made about their care and treatment. And people said they wanted that more. They wanted more information and to be involved more. Interestingly, the Care Quality Commission, which inspect all of our health services, have just produced a report when they made the same point. They said there was a lot of good care going on, but people wanted to be more involved in decision making in inpatient units. So that's something we need to give more attention to. So the study was a cross-national study in England and Wales. So we had 4 NHS trusts in England, 2 health boards in Wales. We had a large number of hospitals involved, 19 wards altogether. So service users, patients and staff across 19 wards were involved. So we conducted a survey using questionnaires with about 300 service users, patients and 300 staff. And we also interviewed nearly 40 staff and 40 service users. We also looked at and reviewed people's written care plans, about 80 of those, and sat in on a number of meetings, ward rounds and other meetings where decisions were being made about people's care. So there was a lot of data, a lot of work analysing all that and making sense of that across the 6 sites and making comparisons. So at City University here, we try very hard to make sure people with lived experience of mental illness, lived experience of using mental health services are involved in all of our research studies. So we had a service user researcher involved as a co-investigator right from the start, designing the study throughout the length of the study. We had a large group of people from across the 2 countries who had lived experience of mental illness and hospital admission, advising us on the study. And we employed 5 service user researchers to go out with our academic researchers to recruit people into the study and conduct the interviews with service users and with family members and carers. Well, we've published the final report and that's all available, freely available on the website. We're producing papers to be written up in peer-reviewed academic journals. And we've presented at a number of conferences, but what we really want to do is influence practice, policy and practice in mental health services. So we've already presented our results to some NHS trusts who are looking at how do they improve their care. We've presented our results to NHS England, who are currently reviewing community mental health services. So we hope that the findings from this study are going to influence practice in the future.